Hello, once again. I am Dr. Jerry Dreessen, the Executive Director for the Association of PEMF Professionals, and I want to thank you for watching. We've been getting a lot of great feedback on our three-part series that we're doing, and we've gone through two of them already. We've had let me bring this up a little bit bigger. There we go. We talked about PEMF and the brain. We talked about PEMF and bone. And this week, we're going to conclude our three-part series by talking about PEMF and the body. And what my goal is with this is to walk you through the things that we are seeing in the research and where you can go to get that research as well. A lot of people are saying, well, how do we know what's happening in the PEMF world? Well, there is a lot of research going out there. So if you haven't seen them already, go back and find these other videos. They're on YouTube and on Facebook, and watch them, and you'll learn about what's happening with the brain and also with the bone, and of course today with the body. So with that, let's jump right in. And if you have any questions, feel free to drop them in the comments here. And it's supposed to pop up so that I can see it. Then I can answer them. But even if you just want to say hi, that's fine too. But right now, of course, we're live on Facebook, on LinkedIn, and YouTube. And what we want to talk about this week, oh, there's Courtney. See, just like that. Courtney, hello. Thanks for joining us today. We're going to talk about the PEMF and the body. So with that, as far as what we find about FDA, that's a really big one. So, these are people that recognize PEMF and what they're okay with, which also helps you in promoting your business and with PEMF. And for me, when I talk to my patients, and I'll say, well, it's FDA approved for, they'll say, well, what is this? And of course, I'll have some images of, animals and people using PEMF. And I say, well, it's FDA approved for bladder incontinence. It's FDA approved for bone, and FDA approved for depression. They'll say, well, why haven't I heard about this? And as you know, there's, you're either in the community that everybody knows about it, or you're branching out, and people that you say this to, they go, oh, you mean a TENS unit? And it's like, no, this is PEMF. And so, to have that little elevator speech on what it's about is what we're trying to help you to create as well. So what I want to do today is look at some more research. And again, like we talked about, PEMF has been FDA approved to treat urinary incontinence, and there are definitely articles that are related to this. Now, if you go to our website to do searches, they may not come up on it, but we're going to talk about the body and how PEMF helps with incontinence. And then there's I've got another one in there too. But if you're watching this for the first time, I don't know why that's so blurry. But if you go to our website and you go to education, then there is the PEMF research, and that's where you type in your search phrase. And so we have, for instance, if you type in the word bladder, you'll see what's going on. And as far as one of the research ones we have on our site, there's a critical review on magnetic stimulation, what its role is in the management of pelvic floor disorders. And it's a great article. Again, you can read it. The take home that I got out of it is reported cure rates for stress incontinence immediately after course of the PEMF range from 12.5% to 52% with good improvement. And people are noticing it right away. So I have a pad that patients sit on. I've got the double loop that they'll put over their bladder. Depends on where you want to aim the beam, I guess, is a way of putting it. But I've had good results with that. And you'll notice too that men have good results with prostate as well because it shrinks swelling. So part of the problem with prostate is when it swells up, it closes down on the urethra as it goes through the system, and it blocks or makes it tough to avoid the bladder. And then also pelvic floor pain, which is huge. In fact, we're talking with another doctor. That is what she specializes in, and we've been talking to her about, introducing PEMF to her group of people. So again, there's a lot of great things that PEMF can be used for in a human setting. The next one that I found was pulsed electromagnetic field with or without exercise therapy in treatment of benign prostatic hyperplasia. So again, this is what we just talked about, where they had a group of 60 male patients aged 55 to 65 with benign prostatic hyperplasia, and they were invited to participate in the study, and they were randomly assigned to a group A, group B, and group C. Group C was like totally placebo, so it was like a machine that made noise, or however they hook it up so that the person getting it thinks they're getting it. And then the difference between A and B was doing pelvic floor and aerobic exercises. And again, I think the take home on that was the present study demonstrated that electromagnetic field had a significant impact on the treatment. So when we talk about, we should try these things, doing sessions to help people out, they're like, well, how do you know this works? How do you know this will work? And now we can talk about research studies are showing that this works and that it's published. Now, there's a lot more things going on. There's a lot of research studies that are in the process of getting finalized and published on PEMF, but these are the ones that you can begin quoting for people. So a couple of other things for you to keep an eye on as far as research: magnetic stimulation for stress urinary continence. And this is a randomized control study. What I like about this is that it's a large group. So they had 120 subjects with stress urinary incontinence, and they're in the process of doing this study. They haven't come out with the conclusion yet, but you can read what it's all about. And again, it's either going to be an active or a sham, and that's how you really want to do this. And if you can do a double-blind study, that's where the people giving it don't know if they're giving the real thing or not, and the people receiving it, they don't know if they're receiving a real thing or not. So that to me is the best of the research study, and I'm going to bet that they find a huge difference. So take a look at these research studies and type in the areas that you want to help do sessions on. Or if somebody has a problem, like they say, does PEMF help with elbows? You can go to our research, type in elbows, and see if there's any current research or if there's been any research done on those types of things. And then again, the research people, they are techno geeks and medical geeks, and so they may say olecranon instead of the elbow, and then start throwing in the Greek words for these different pieces of body parts. So enter the search phrase in differently to see if you get the result that you need. So short broadcast today. We've got again, we talked about the brain, bone, and now the body. For me in clinic, I'm treating shoulders, I'm treating low back, I'm treating knees, I'm treating feet, neuropathies. I'm getting really good results with all of those things. And it has to do with the machines that you have as far as time and the placement, and then also the power. So we're going to be putting together another series pretty soon that kind of goes through what we hope to be very informative on the different machines, because I know that being an international organization, 17 countries and thousands of members, everybody has a different machine. So if you can understand a little bit more about how yours works, if you're not getting that from the manufacturer and best practices, that is the next system that we're going to be putting together. So be on the lookout for that as we tick off our final of our 3 here. And again, those of you just joining, you can check out the other 2 online. We are in, we're on Facebook, LinkedIn, and YouTube Live right now, but you can find this broadcast on those channels. And as we round out the talk, again, what does the FDA say about body health? And as you saw in the broadcast, I could bring up some good information. And again, FDA saying, what's good and what's not, if people need to hear that. So a lot of people, when they hear FDA, they go, okay, well, somebody has looked at it and given it a thumbs up, other than the people that make the machines. And that's kind of what we're looking at getting approval for. So what can you do to help us out is to get the word out to more people. The more you like and share, whether on Facebook or LinkedIn or YouTube, Instagram, every time you click a like, every time you leave a comment, it puts us up higher in the feeds of other people that have PEMF machines or that are looking for PEMF care to do sessions, and which is beginning to happen now. So if you want to be seen in your community more, help us get our information out in front of these people so that they can find you. All you have to do is like and click, like and share. And also, if you have any questions, you can reach out to us and get in touch with us with info@pemfprofessionals.com. Definitely become a member. Your money, your membership, it's very inexpensive to become a member, but we take your funds and it helps us reach out to legislation. It helps us create and generate our ads that we're doing, where we can find more people to help promote you. Helps us to rebuild our website, which we're in the process of getting it set up, getting a few more bugs knocked out. And again, I apologize if you're trying to call us on our number. In January, they had a new regulation for 800 numbers, and we had to verify that we are a business, an LLC, which we are. And then we just got that approved. So if you're still finding it a little buggy, again, reach out, just send us an email, and we'll be more than happy to get to you. If you know somebody who is interested in about learning more about PEMF, also have them reach out to us too. So again, thank you for those of you that are watching. We had a pretty good turnout today, and we'll be sending this out as soon as I end the stream. And be on the lookout for in the coming weeks where we do our next series on machines and power and what does what and how do you do what to who and how do you do what to what. That's a pretty long sentence, but maybe we can work that in. All right. With that, have a great day, and we'll see you next week. Take care.